Hey guys, for our next lecture, it's exercise for special populations. By this point in the course, it should definitely be clear that therapeutic exercise encompasses a wide range of therapeutic and treatment options as a PT and PTA. The previous chapters that are in this textbook for the Kisner and Colby, they go over general concepts and, more region specific as well as patient and population focused. And especially for like the older adults, the women's health and lymphatic disorders. So the key takeaway here is with therapeutic exercise programs, it has to be patient specific, need to be able to adapt to the movement systems that are impaired, as well as, seeing about the treatment responses of how you would progress a patient is going to be ongoing throughout the whole session. So, with exercise, it's beneficial overall for health and well-being. And, you have to be aware of excessive intensity, duration, or frequency because this can harm patients, especially those with chronic or degenerative conditions. And these types of individuals will require more carefully modified exercise programs to avoid these exacerbation symptoms or worsen their conditions. So throughout this chapter, definitely important for essential guidance of safe to safely implement therapeutic exercise in these specific patient populations. So we're going to go over, several different things about each one of these, the summaries, even evidence-based recommendations. Now, the WHO, or the World Health Organization, exercise guidelines for adults 18 to 64. It is recommended for them to perform 150 minutes a week of moderate intensity aerobic activity or 75 minutes a week of vigorous intensity aerobic activity. Now, just keep in mind when we go through all of these different numbers and what's recommended, it's very important, especially for your NBTAE that you're going to take one day, because I know that they're going to be taking a lot of this more specialized populations and building a more complex patient. So what is recommended for that patient is going to be so important that you know. So some other things to add on to that. For resistance exercise for this age group will be twice a week is what's recommended. Now, obviously, you're going to adjust these guidelines based upon the individual and their health condition that they have going on, and need to be aware of their exercise capacity and risk factors. So for the first disease and condition that we're going to look at is going to be obesity. Obesity is characterized by excessive or excess body weight, primarily stored form of stored fat, associated with definitely a lot of significant negative health impacts, and can contribute to major diseases leading to morbidity and mortality. And this is what has been critical in our health issue in the United States. So by definition, obesity is classified by a body mass index or BMI over 30, and this is calculated in weight in kilograms that is divided by height in meters squared. The prevalence, so over 40% Americans are obese, and this annual medical expenses is exceeding 150 billion. Treatment approaches would be treatment typically involves like lifestyle modifications, needing to change their diet, their physical activity, supported by behavior therapy to enhance adherence. Some common impairments associated, so for those of obesity patients or obese patients are at increased risk of several different health conditions. Some chronic conditions that are, at risk would be hypertension, dyslipidemia, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, obstructive sleep apnea, respiratory problems, osteoarthritis, and certain cancers. When it comes to functional impairments, mobility challenges such as difficulty walking, they might have a hard time going up and down stairs, going and transferring or transitioning or ambulating to and from surfaces. And obviously this can negatively affect their employment, their self-care, and performing activities of daily living. Some additional issues, they might have dyspnea on exertion, sleep awake or sleep wake rhythm disturbances. They can also have musculoskeletal disorders and social anxiety. So with the complexity of treating an obese patient, you know, you have to make it individualized and being able to come up with different intervention strategies. So before starting an exercise program, this is the pre-participation evaluation is definitely essential for obese individuals, as their treatment is directly related to obesity or not. So this would entail, just like any other patient, a detailed history, physical examination, and also to identify what kind of core morbidities and cardiovascular risks that they are associated with. Using a physical activity readiness questionnaire or PAR-Q and health fitness facility participation screening questionnaire from the American Heart Association and ACSM. So some exercise program goals. So weight loss, weight management, and prevention of weight gain. And definitely tailoring the program not only in that, but also with balance, safety, and also looking at the effectiveness of these. Now, exercise recommendations. So aerobic exercise. So maybe an example would be to encourage walking. Initial goal might be to, walk 30 minutes a day and 150 minutes over the week. For weight loss management and prevention of regain, it's recommended for them to perform 200 to 300 minutes per week. Longer duration, longer intensity sessions can be, over 30 minutes, focus on the fat as a primary fuel source. As far as intensity and volume, you want to begin at 40 to 60% of a VO2 reserve, which you would have to calculate, or 55 to 75%, 55 to 70% of a heart rate max, which it can easily be calculated. So greater exercise volumes are required for weight loss compared to improving fitness. Now you can also combine exercises such as aerobic and resistance exercise is more effective for weight management, especially for women. And looking or having them perform like in person or virtual supervised programs can improve fitness and adherence. As far as activity levels, and characteristics, younger individuals or those without significant risk factors may engage in moderate vigorous intensity exercises without needing a stress test. But with older adults or older individuals or those with risk factors, this could require a medical exam or stress test before performing any kind of vigorous activity. Now, those with cardiovascular diseases, they may also require a medical clearance and stress test before moderate or vigorous activity. Depends on actually if they have already been performing any kind of other endurance training. Precautions, you're going to monitor for hyperthermia during exercise and you'll need to adapt the environment accordingly. You need to be aware of medication effects on exercise responses and aware of the exercise goals for the individuals over 80 must consider that, how frail they are and based upon their muscle loss and from dietary changes. There is a higher joint reaction forces with obese individuals, and that is why low impact activities for cardiopulmonary fitness is important to incorporate. Now, when you're looking at the multimodal treatment approach, so to manage obesity, there's a lot of combination of counseling and diet and exercise, as well as pharmacological interventions, and involves a multidisciplinary team. Some precautions. So obese individuals are at risk for hyperthermia during exercise, so you need to be important, like I said, about the environment and being aware of any kind of medications that they are taking. Okay, so our next topic or disease is the metabolic syndrome, also known as MES. So metabolic syndrome is a cluster of risk factors that significantly increase the likelihood of developing type 2 diabetes and cardiovascular diseases. These risk factors include abdominal obesity, which is the most significant variable, hypertension, if they have a low HDL, because we want a high HDL because of, you have your overall cholesterol, but you want your LDL to be lower and you want your HDL to be higher. So here with this, they're at risk when they have low HDL cholesterol. If they have elevated serum triglycerides and insulin resistance. With abdominal obesity, it can contribute to systemic inflammation, and this can be modified through exercise with improving metabolic health and reducing cardiovascular risk. This affects over 20% of the global adult population, about 1/3 of adults in the US. So some common impairments, they could have insulin resistance, which leads to elevated insulin levels after consuming carbohydrates. They can also have abdominal adipose or adiposity, and it causes mobility limitations, therefore deconditioning, reduced lung function due to its mechanical effect on the diaphragm and chest wall compliance. They could possibly also have a cognitive decline, which could link to other conditions such as Alzheimer's disease and dementia. So some considerations for exercise. Primary goal of exercise is to reduce abdominal adipose tissue, and this drives the systemic inflammation and insulin resistance. So here are the recommendations. That they perform a minimum of 150 to 250 minutes of moderate intensity aerobic exercise per week, and this is through ACSM guidelines. Aerobic exercise alone or combined with resistance training is effective in reducing the weight circumference regardless of the intensity level. So some advanced strategies, if they perform longer durations and greater frequency of aerobic exercise, it is more effective for reducing systemic inflammation. If they perform high intensity interval training, or known as HIIT, HIIT, this will be more effective, highly effective for reducing abdominal fat and as well as other MES factors. So for example, if they performed alternating 15 to 30 seconds of cycling at 80% of maximal aerobic power with 15 to 30 seconds of rest would be recommended. All right, so from prevention through resistance training. So if they perform resistance exercises 1 to 2 times per week with or without aerobic activity, this can lower the risk of developing metabolic syndrome. With weekly resistance training of 1 to 59 minutes will reduce the risk by 29%. And training 4 days per week will lower the risk by 38%. So based upon evidence that's mentioned in your textbook, that a 9-month HIIT program with 2 to 3 sessions per week paired with resistance training and nutritional counseling demonstrated a 32.5% reduction in the metabolic syndrome prevalence. And also showed improvements in body mass, weight circumference, fat mass, lipid profiles, and triglyceride and HDL ratios. And there was no adverse events with a 97% adherence rate. So based upon these findings, it shows that how important exercise program is for managing and preventing metabolic syndrome, and also emphasizing using both aerobic and resistance training to have an optimal outcome. Another common condition you're definitely going to see is type 2 diabetes, which is a chronic condition in which the body does not produce enough insulin or cannot use it effectively. And this will lead to elevated blood glucose levels. And over time, it can result in complications such as vision loss, cardiovascular disease, and kidney disease. It is the most common form of diabetes. So risk factors include overweight or physical inactivity, ages 45 years or older, family history of diabetes. If they are higher, there is a higher prevalence among African Americans, Hispanic Latino Americans, American Indians, and Native Alaskans. Common symptoms would be frequent urination. There'll be an increase in thirst and or hunger, fatigue, vision changes, numbness and tingling in the extremities, have dry skin, slow healing with cuts and sores, which is really important to know in therapy, and unexplained weight loss. So some common impairments associated would be neuropathy, which is this is like the symptoms would be like numbness and tingling or pain and loss of sensation in the extremities. This will affect their with impaired they'll have impaired balance, impaired dexterity, sorry, delayed awareness of injuries and chronic ulcers. And severe cases may lead to infection and amputation. They can also have circulatory and sensory issues, so poor circulation and slow wound healing will definitely be more particularly to the feet. Hearing and vision loss due to vascular nerve damage can contribute to fall risk. So some considerations for exercise. So exercise improves insulin sensitivity, regulates blood glucose, reduces cardiovascular risk, and decreases hemoglobin A1C levels. So here's the recommendations. Aerobic exercise for 30 minutes of moderate to vigorous exercise for 3 to 7 days per week, targeting at a 60 to 90% heart rate max. And this should be performed at least 150 minutes per week with no more than 2 consecutive days without exercise. Now, daily exercise will maximize the short-term insulin resistance and it will improve, daily exercise maximizes short-term insulin resistance improvements. Now, with resistance training, it's recommended for them to perform 2 to 3 sessions per week, targeting 8 to 10 muscle groups, and perform 1 to 3 sets of 10 to 15 reps at a moderate to vigorous intensity. And this will enhance insulin sensitivity and lipid profiles. Now, you can also do combination training, such as aerobic and resistance, as this is going to be the most effective for blood glucose and lipid levels. You can also include HIIT training. So, for example, they could perform 4 to 6 sets of 30-second vigorous exercise with 60 seconds of rest, and then this will be totaling of 10 minutes. And it can also reduce insulin resistance and improve glucose regulation. So some precautions. So having your patient and make for sure that you're always inspecting their feet. So visual foot inspections. And this should be before and after exercise for irritation, blisters, or open sores. You might have to modify weight-bearing exercises for those with foot ulcers to limit the pressure. With hypoglycemia risk, you want to avoid exercise within 24 hours of a hypoglycemic event requiring assistance. So if blood glucose is less than 4.0, then it's going to be contraindicated to perform exercise. You always want to test the blood glucose before, during, and after initial exercise sessions, and this is very important so that we can assess its effects. You want to supervise the exercise or maybe they can work out with a partner. It's definitely recommended. So if they have elevated glucose levels, so exercise with caution if blood glucose is more than 15, and you definitely want to monitor them closely. So with it's optimal timing. So with timing with exercise, this should be personalized based upon how the patient's blood glucose patterns are and also the and how to provide medical guidance. So just the key things about safety. So there's no specific pre-participation screening that is required, but you want to encourage a gradual program where you can adjust and optimize safety and have benefits. And also, performing regular tailored exercise programs and with combining this aerobic and resistance elements, this is definitely very critical for effective diabetes management. Monitoring and for safety precautions and having that professional input will ensure improved outcomes while minimizing risk. All right, so there was quite a bit of information compared to the other pathologies, which is kind of surprised about cancer. So cancer refers to a group of diseases that is characterized by the uncontrolled division and spread of abnormal cells in the body. And with this unregulated cellular proliferation, it can arise from genetic mutations and which can be inherited or acquired due to factors such as environmental exposures, lifestyle, or random DNA damage. These mutations can lead to the formation of tumors, masses of abnormal cells. They can also invade surrounding tissues and in some cases can metastasize or mets to distant parts of the body. Globally, cancer affects millions, and the most common types include skin, lung, breast, colorectal, prostate, stomach, liver, esophageal, cervical, and thyroid cancers. So, since, even though it has significant morbidity and mortality rates, there's advances in earlier detection, treatment options, and supportive care that has improved survival rates and has resulted in 15.5 million cancer survivors in the United States alone. So survivors are individuals who have received a cancer diagnosis and are living through or beyond its effects. Now, cancer treatments can vary depending on the type, stage, or progression of the disease. This could include surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy, hormone therapy, stem cell transplants, and precision medicine. But these treatments often result in additional physical, cognitive, and emotional impairments that can definitely affect the survivor's quality of life. Now, some common impairments that survivors are usually faced with beyond the disease itself, is physical, cognitive, and emotional domains. So with fatigue, they could have for persistent and debilitating fatigue that affects approximately 25% of survivors, and it impacts their daily activities, employment, and quality of life. With cardiovascular health, certain cancer therapies increase the risk of cardiovascular disease, which this contributes to the rise in percentage of cardiac-related deaths among survivors. Now, with peripheral neuropathy, chemotherapy induces a nerve damage and can cause numbness, tingling, or pain in extremities, and this leads to balance issues, reduced mobility, and a higher risk of injury. They can also have cognitive dysfunction. This is also known as chemobrain, and survivors may experience memory lapse, difficulty in concentration, and cognitive slowing both during and after treatment. Another is nausea, and it's a common side effect of chemotherapy, which significantly impacts appetite and energy levels. They can also develop lymphedema, which is disruption of the lymphatic system during treatment and can cause fluid retention, particularly in the arms and legs, and can lead to swelling, discomfort, and mobility challenges. With sleep disorders, many survivors will experience poor sleep quality or insomnia and have exasperating fatigue and emotional stress. They can also have mental health, which could include anxiety, depression, post-traumatic stress, are prevalent and often stemming from an emotional toll of the disease and treatment processes. So here's some consideration for exercise. So exercise is increasingly recognized as a key component of cancer care, both during and after treatment. And evidence suggests that regular physical activity, with many cancer-related impairments, can improve physical and mental health and enhance quality of life. However, exercise interventions should be tailored to the individual's unique needs based upon their cancer type, their treatment history, as well as their comorbidities. Now, as a pre-exercise assessment, is definitely recommended before initiating an exercise program. And this could include, understanding the type of cancer, the treatments that they're receiving, as well as any associated comorbidities, such as do they have peripheral neuropathy, or do they have poor bone health, or do they have lymphedema? It's going to make a big difference. The National Comprehensive Cancer Network, or NCCN triage, has different guidelines for determining when a medical evaluation or referral is to specialized personnel is definitely required. So it's required to review those medical evaluations for guidelines. Now, exercise benefits. So with fatigue, with moderate intensity aerobic exercise, like 30 minutes of walking 3 times a week, has been shown to reduce fatigue. Resistance training and combined aerobic aerobic resistance programs are just as effective to reduce fatigue. For mental health, exercise significantly reduces symptoms of anxiety and depression. So they could perform exercises such as yoga, tai chi, low impact aerobics are particularly beneficial. With lymphedema, gradual resistance training under supervision can improve in lymphatic flow and reduce swelling. Also, benefits of bone health. So, high impact and resistance exercise can enhance bone density and reduce fracture risk in survivors with bone metastasis or osteoporosis. Benefits of cardiovascular and physical functioning. So, with aerobic training, this can improve heart health and endurance, while resistance exercise can enhance muscle strength and physical performance. Here are the recommendations. So, with aerobic exercise, if they perform moderate intensity activities of 65 to 80% of a heart rate max for 20 to 30 minutes, 3 to 5 times per week. And with resistance training, this with progressive resistance exercise and targeting major muscle groups, perform 2 to 3 times per week with 2 sets of 12 to 15 reps. And just like the other ones we mentioned, you can do combined programs. So integrating both aerobic and resistance exercise is yielded to be the best outcome for fatigue reduction and quality of life improvement. With high intensity interval training, doing short bursts of vigorous exercise and alternating with recovery periods are effective for reducing fatigue and improving insulin sensitivity. Now, precautions and safety considerations. So, exercise is contraindicated with individuals experiencing severe fatigue if they have an active infection or uncontrolled comorbidities. Some other precautions would be blood counts, like including platelets and hemoglobin levels, should be monitored to ensure that they are within safe ranges of exercise. Skin integrity at the surgical or radiation sites definitely must be assessed before initiating exercise to avoid any kind of tissue damage. Being aware of hypoglycemia, particularly with individuals who also receive insulin or other medications, and this should be closely monitored during exercise. Now, this is a collaboration of care. So not only is used PTAs, but you're going to be using PTs, exercise. You could also use exercise physiologists and other trained professionals to collaborate with oncology team to design individualized exercise programs. This can ensure that the interventions are evidence-based and can account for the patient's overall health status, treatment history, and goals. So with incorporating these exercise programs into cancer care, this can improve and enhance survivors their physical and emotional well-being, manage their treatment side effects, and achieve a higher quality of life. There's, with continued research and interdisciplinary collaboration, this is definitely critical to optimize exercise interventions for this diverse population. All right, so chronic pain disorder. So chronic pain is defined or referred to as also as chronic pain syndrome. It is characterized by its duration, the perception of pain that persists beyond the typical phases of healing. So unlike acute and subacute pain, this occurs as part of the body's natural response to injury or illness. But with chronic pain, it's defined by its persistence for longer than 6 months. It often remains even after the original tissue damage or illness has resolved. So if you think about it, since chronic pain is referred to as longer than 6 months, acute is 3 months or less, so that subacute is between the 3 to 6 month mark. Say what else I was going to say. As I said, it often remains even after the original tissue damage or illness has resolved, and this is what makes it a complex condition to manage. It can result from various underlying conditions, such as low back pain, which is pretty common, whiplash, fibromyalgia, headaches, TMJ, which is temporomandibular joint disorder, osteoarthritis, and rheumatoid arthritis, or known as RA. So I know that we have discussed a lot of these conditions previously, but chronic pain disorder represents as a secondary diagnosis and is persistent state of pain and can develop regardless of the regardless of the medical condition, of the initial medical condition. So historically, it was managed through a biomedical model and emphasizing pharmaceutical interventions. And chronic pain disorder is now understood as a physiosocial condition. So, the shift was recognized because the intricate interplay between biological, psychological, and social factors that contribute into chronic pain. With a multimodal approach to management, this can include patient education, behavioral modification, exercise, medication, and also combining different therapies. And this is what is widely recommended. Pain neuroscience education, which I love, or P&E, has emerged as a promising and effective component for addressing chronic pain to help patients reframe their understanding of pain and regain control over their lives. So some common impairments. Individuals with chronic pain disorder, they usually have frequently experience a range of impairments that impact their physical, emotional, and social well-being. And that, of course, is pain. It could be persistent, and it's often debilitating, and pain is the hallmark symptom. It can interfere with daily activities and quality of life. Also with sleep disturbances, so poor sleep quality is commonly reported and is because of the ongoing discomfort and stress associated with chronic pain. Emotional health, so anxiety, depression, they often feel, feelings of hopelessness, and these are definitely frequent companions of chronic pain and can both be a result of contributing factors to the pain experience. So with fatigue, so managing chronic pain requires significant physical and emotional effort, and which often leads to having exhaustion. So they'll usually have limited joint range of motion and muscle atrophy. So long-term protective postures and avoidance of movement can result in this stiffness. They can also have loss of flexibility and reduced muscle mass. They can have strength and motor control deficits, so inadequate muscle recruitment and poor control are often observed, and this further impairs the functional abilities. Now, kinesiophobia, which we don't want any of our patients to have, is known as fear of movement, but chronic pain patients definitely have this or could have it. And this is driven by the anticipation of or experience of pain, and this limits physical activity and contributes to a sedentary lifestyle. Another is called pain catastrophizing. This heightens the psychological focus on pain, and it amplifies its perception, which creates a cycle of fear and disability. Another would be reduced participation. So chronic pain often affects the ability to engage in ADLs, work, and recreational, activities. So considerations for exercise. So exercise is very critical in managing chronic pain disorder. And, to engage in physical activity when experiencing pain might sound counterintuitive. But a structured exercise program can lead to significant improvements in physical and emotional well-being. So here's the benefit, or the key considerations would be aerobic exercise benefits can decrease pain perception. It can also enhance cardiovascular fitness, physical conditioning, and overall quality of life. With starting with a low and gradual progression, so beginning with low to moderate intensities and building that pain, and to minimize pain flares and build patient confidence. So that's really, really important. Even how it doesn't matter how low it is of where you're starting at. You might have to start off really, really small with like range of motion and exercise. Now, aerobic exercise is typically less likely because of this generalized pain compared to resistance exercise. So intensity recommendations. So for pain reduction, it's recommended for them to perform 50 to 60% of a heart rate max with low to moderate intensity. For cardiovascular fitness, it's recommended for them to perform 60 to 80% of a heart rate max. or moderate to vigorous intensity. This is definitely an approach that is patient-centered and involves having the patient select their preferred exercise, meaning their type and the dose of exercise, and this will help with the adherence to the program. So using a time contingent approach to set exercise duration rather than relying solely on repetitions or sets can help deactivate this pain facilitatory pathways. So for educational and safety, definitely want to emphasize that safe volumes of exercise will not cause tissue damage, even if it's mild discomfort that is being experienced. Recovery periods are important because this allows sufficient time for recovery, especially when starting a new exercise program. And this will reduce the likelihood of overuse or exacerbation of symptoms. Now with the application of ACSM guidelines, so due to the absence of condition-specific exercise guidelines for chronic pain disorder, the ACSM for older adults is what is recommended for as the framework. So make sure you look over that information. The pain neuroscience education. So how can you integrate it? So incorporating this PNE principles and educating your patient will help them understand how the effects of pain is related to physical activity, and this can empower them to be more confident and to move more freely and safely. So by recognizing chronic pain disorders, this as a complex, multifaceted condition, us as healthcare professionals can implement a holistic approach and to improve the patient's physical function, emotional health, and quality of life. All right, next we have is hypertension, or HTN, is commonly referred to as high blood pressure, defined by chronic elevation in resting systolic blood pressure of 130 millimeters of mercury or diastolic pressure of over 180 millimeters of mercury. So just keep in mind that those change every once in a while, but those are the current recommendations is 130 over 80 for hypertension. And it doesn't matter if, let's say you have 130 over 70, you still have hypertension because it's systolic. If it was 120 over 80, which we thought was, not hypertension, that is actually considered hypertension, the 80 is. Its prevalent condition affects approximately 40% of adults aged 25 and older worldwide, and 33.2% of adults aged 20 and older in the United States. Men are more likely to develop hypertension compared to women, and prevalence is higher in individuals from nations with higher standards of living. So hypertension is a leading risk factor for cardiovascular disease, and this contributes to complications such as CVA, cerebrovascular accidents, or stroke, as well as myocardial infarctions, like an MI or heart attacks, and this collectively causes over 9 million deaths globally each year. Some common impairments, so hypertension is often asymptomatic, giving it its nickname, the silent killer. Diagnosis typically requires regular monitoring of blood pressure, and as there are no overt movement system impairments directly linked to this condition, however, some individuals may experience angina during physical exertion, which can indicate presence of hypertension or other cardiovascular concerns. Now, considerations of exercise would be, so with regular physical activity, this plays a vital role in management and prevention of hypertension. Evidence suggests that exercise can significantly reduce both systolic blood pressure and diastolic blood pressure and improve overall cardiovascular health. Benefits of blood pressure reduction. So a decrease of 10 millimeters of mercury in systolic blood pressure is associated with a 25% to 54% reduction in the risk of a cardiovascular accident, and also a 16 to 46% reduction in the risk of an MI. For exercise and blood pressure, so the greater the volume of exercise, the more reduction of resting blood pressure. Now, the effectiveness of different exercises. So with aerobic training, it's encouraged for them to perform a minimum of 4 weeks of consistent aerobic exercise. And this has shown a mean reduction or an average reduction in systolic blood pressure by 8.3 millimeters of mercury, and a reduction in diastolic blood pressure by 5.2 millimeters of mercury. So with resistance training, so while not, it's not as effective as aerobic training, but it can benefit individuals with elevated resting blood pressure, especially if you combine it with aerobic activities. So if you combine the aerobic and resistance training, it has shown an average or mean reduction of 5.3 millimeters of mercury for the systolic and 5.6 for the diastolic. Isometric training. So, there's more emerging evidence that suggests that isometric exercise can help reduce both systolic blood pressure and diastolic blood pressure, which is pretty interesting. ACSM recommendations for the FIT system are FITT. So frequency. So it's recommended for them to perform exercise most days of the week. So 5 would be good. Intensity, moderate intensity, aiming for 40 to 60% of a heart rate reserve or HRR. The time would be at least 30 minutes per session and can, be up to 150 minutes per week. Type, so emphasizing for them to perform like aerobic activities such as walking, cycling, swimming, and also incorporating resistance or isometric exercises as tolerated. Some precautions, you want to avoid activities that cause rapid increase in cardiac demand, such as sprinting or heavy weightlifting, as this can exacerbate the blood pressure and place excessive strain on the cardiovascular system. You want to make for sure that they're performing a proper warm-up and cool-down periods to prevent sudden spikes in blood pressure. So by adhering to these exercise guidelines and making necessary precautions, individuals with hypertension can achieve better blood pressure control, reduce the risk of cardiovascular complications, and improve health outcomes. So one that you'll probably definitely see in these parts of Kentucky, Eastern Kentucky, is going to be COPD, chronic obstructive pulmonary disease. This is known as a group of progressive respiratory conditions characterized by airflow limitations, dyspnea, which is like the shortness of breath, and exercise intolerance. So like I just said, common symptoms include shortness of breath, also known as dyspnea, difficulty breathing deeply, coughing and wheezing, excessive sputum or phlegm production, and these risk factors for COPD include tobacco smoke. This is primary, or it could be because of secondary exposure. Air pollution or occupational exposure to irritants. A history of asthma. Demographic factors show that, such as being female or older than 65 and low socioeconomic status, it would be a risk factor. So COPD is associated with skeletal muscle dysfunction, definitely significant morbidity, and a high mortality rate. It affects quality of life and functional independence and has a significant impact on physical, mental, and social well-being. So some common impairments for those with COPD, they can experience a reduced functional mobility, such as difficulty with walking, maybe stair climbing, and community ambulation. Also, they might have to rely on assisted devices such as canes, walkers, and portable oxygen tanks. So with activity fatigue, they could have decreased endurance and overall physical conditioning, which would be decreased. Psychological impacts, so higher prevalence of confusion, also memory loss, depression, and anxiety compared to individuals without COPD. With progressive deconditioning, with sedentary lifestyles will reduce physical capacity and further will limit their breathing function. So exercise plays a central role and it's very important to manage COPD. It can improve pulmonary function, physical capacity, and quality of life, especially for those incorporated into a pulmonary rehabilitation program, also known as PR. Some exercise recommendations would be aerobic exercise, frequency of 3 to 5 sessions per week, intensity of moderate to vigorous based on the individual's tolerance. So an example would be 40 to 80% of the VO2 reserve or VO2R or heart rate reserve. So the time, So you want to start with a shorter session of 10 to 20 minutes and progress to 30, 60 minutes as tolerated. So the type would be walking, cycling, or other rhythmic activities using large muscle groups. Resistance training, so frequency of 2 to 3 sessions per week, intensity of a moderate 60 to 70% of a 1 rep max. Sets and reps would be 2 to 4 sets of 8 to 12 reps, targeting the major muscle groups. Type can include free weights, resistance bands, or body weight exercises. Breathing exercises are also great. It focuses on improving diaphragmatic control, reducing the accessory muscles that they're trying to maybe use, and also increasing oxygenation. So some different types is pursed lip breathing, diaphragmatic breathing. There's also slow deep breathing and relaxation breathing. Interval training, so it's recommended for individuals with COPD or with advanced COPD due to better tolerance compared to continuous training. So there's definitely some precautions involved. Pre-participation assessment is essential for starting an exercise program. This includes pulmonary function test, arterial oxygen saturation, which is known as SaO2, and dyspnea ratings using the Borg CR10 scale. You want to avoid overexertion and monitor for signs of breathlessness or fatigue. And, post-exasperation with these pulmonary rehab programs to incorporate controlled exercise and breathing exercises, this has been shown to reduce hospital readmissions. But using the Borg CR10 scale to monitor the perceived respiratory effect during exercise is beneficial. Breathing exercises such as pursed lip breathing and ventilatory feedback training has been shown to improve respiratory function, but their effect though their effect on functional capacity is limited, such as doing like a 6-minute walk test. So with evidence-based insights, so with research, definitely shows that specific breathing exercises is very important for individuals with COPD. So we'll look at pursed lip breathing, or PLP, is effective improving respiratory rate, tidal volume, and inspiratory time. I suggest if you don't know what that looks like, look in your score builders information, and also O'Sullivan and the Skizner and Colby textbook should have it as well. With the pursed lip breathing, it can have limited effects on functional outcomes like the 6-minute walk test. With ventilatory feedback and diaphragmatic breathing, this is beneficial for improving respiratory efficiency and overall pulmonary function. By combining regular aerobic and resistance exercises with targeted breathing interventions, individuals with COPD can enhance their physical and respiratory capacity, which can lead to improved health-related quality of life. Next up is spinal cord injury. A spinal cord injury is an acquired condition resulting from localized damage to the spinal cord, which causes partial or complete paralysis. Most often, a spinal cord injury is due to a traumatic event that fractures or dislocates vertebral segments and leads to compression of the spinal cord by the bony fragments, or it could be the disc materials, or as well as the surrounding tissues. This compression damages the axonal tissue and results in a motor and sensory deficits below the injury level. The spinal cord injury, it also can result from a non-traumatic effect or causes such as spinal cord tumors, with damage potentially related to treatment interventions. So approximately 300,000 individuals in the United States live with spinal cord injuries, and they encounter significant physical, psychosocial environment challenges that impacts their mobility, ADLs, employment, and also performing and recreation activities. And this reduces, these barriers will often lead to reduced activity and deconditioning. Some common impairments, upper body overuse injuries. This is because of the frequent use of manual wheelchair propulsion. They could definitely have skin breakdown because of the prolonged pressure over the bony landmark areas while seated or lying down. They could have autonomic dysreflexia. This is a life-threatening condition and is marked by a sudden rise in blood pressure and is often triggered by irritants below the entry level, which could be even wrinkled clothing or even like a cath bag, or a cath tube could significantly impact that and trigger it. So with bone health issues, so decreased weight-bearing activity and lack of muscle activation will cause a reduced bone density, and the paralysis-related limitations, so muscle inactivity can restrict physical movement, therefore impacts their independence and ADLs. So considerations of exercise, cardiometabolic health. So leading cause of death in adults in spinal cord injury include cardiometabolic diseases. So it's recommended to perform moderate to vigorous aerobic exercise, performed at least 3 times per week, can be very beneficial in cardiometabolic health. To go more about the exercise recommendations, so aerobic exercise, moderate to vigorous intensity, 2 to 3 sessions per week for 20 to 44 minutes. Resistance training, so strengthening exercises with targeting major functional muscle groups, performed twice a week. So like 3 sets of 10 reps at 50 to 80% of a 1 rep max. Some barriers to exercise, so maybe they have lack of accessibility or lack of adaptable exercise equipment. It could also be because of financial constraints or difficulty with transportation. Some precautions would be to watch for signs of upper body overuse injury, skin breakdown, the autonomic dysreflexia, and also overheating during exercise. So there is a systematic review mentioned that with high confidence supports the effectiveness of upper body exercise, can improve fitness and cardiometabolic health outcomes with those with chronic spinal cord injuries. That fitness improvements include enhanced cardiorespiratory fitness, power output, and muscle strength. So even though exercise benefits bone health, the confidence in this finding remains low, meaning that there's not enough evidence to support or show it. So some suggestions too. So the outcome type, intensity, frequency, and duration, cardiorespiratory fitness would be aerobic moderate to vigorous 3 to 5 sessions per week. I already mentioned that. I just mentioned that. Just kidding. Well, you can rewind and listen to that again. Sorry. All right, so this PowerPoint slide, I'm going to be here for just a few minutes because there's multiple diseases and conditions that are mentioned, and there were smaller paragraph form in your textbooks, which I thought was pretty interesting, especially for Parkinson's disease, but I know it's mentioned more in your book and other chapters as well. So, it's really important to know that the many patients that you treat can have more than one health condition, and therefore it's important that you have a comprehensive approach to how you're going to manage these individuals because their complexity and their interaction between these different disease processes, and also as well as pharmacology treatments for each of these conditions. So the interactions of the patient's tolerance and response to exercise is so important to how to manage it essentially. Obviously, health history and physical examination are very important to know about the condition and how impacting exercise capacity, and as well as how it can be might affect each condition. Now, with exercise guidelines for multiple conditions, so with making decisions about exercise, it's recommended to know of each condition, and the exercise prescription should start with the least rigorous parameters to ensure that the exercise is appropriate for all conditions. For example, for a cancer survivor who also has hypertension. So hypertension may recommend moderate to vigorous intensity exercise, aerobic exercise, but cancer survivors may require low to moderate intensity exercise. So in this case, it's important to start with a low intensity aerobic exercise would be the most appropriate, and as it accommodates both conditions, this approach can reduce the risk of overexertion and ensure safety. So some precautions. You need to be aware of the most serious precaution for each condition. So when you're dealing with these multiple conditions, want to focus on the most restrictive precaution and this should guide your decision making. So, for example, if one condition is contraindicated for certain types of movements, or there are concerns about medication side effects, this should be priority when you're involving it in the exercise plan. So monitoring the patient's response. So as a plan of care, as you progress your patient, and as you do regular monitoring to see what the patient's response is to exercise, is so important, as this is not only, not only that, but also tracking vital signs, including heart rate, blood pressure, oxygen saturation, watching for other signs of discomfort or overexertion. Some physical changes that you can also monitor would be like the breathing patterns, like is it labored? Is it shallow breathing? Looking for skin color. Are there signs of cyanosis or pallor? Perspiration. Wow. Excessive sweating or lack of sweating. So any changes in any of these could indicate and should be addressed immediately. And exercise intensity should be adjusted depending on, what's necessary. So each condition is definitely can impact the exercise tolerance. So prioritizing safety and looking at this as how are you going to individualize it to your patient. So you can definitely perform effective plan of, your PT can develop an effective plan of care to address these complexities of treating individuals with multiple health conditions. This approach not only enhances patient safety, but improves outcomes and quality of life for patients with these multiple conditions. So Parkinson's disease is a progressive neurodegenerative disorder that primarily affects movement. These key symptoms would be reduced motor skills. That might be because of reduced magnitude, speed, and coordination of fine and motor movements. They could also have resting tremors, and they are involuntary shaking or trembling of limbs, and especially will be typical at rest. Rigidity is muscular stiffness or tightness, which limits the range of motion and can cause pain. Postural instability, so they could have difficulty maintaining balance and coordinating body posture, which can significantly increase the risk of falls. They can also have difficulty initiating movement, like that Parkinsonian gait. They can also have trouble starting voluntary movements such as walking or turning. And in addition to these motor symptoms, they can also have non-motor symptoms, and that would be like depression, apathy, which is lack of interest or enthusiasm. They could have constipation, loss of smell, sleep disturbances as well. So the disease affects nearly 10 million people globally and about 1 million in the United States. Its incidence increases with age, typically being diagnosed in individuals over 50. And men are 1.5 times more likely to develop Parkinson's disease compared to women. And that's it for Parkinson's. But just make for sure you look over that information and what exercise recommendations could be out there, because I know that was one of the examples of a possible test question that was given in a meeting that I was at. So make for sure you look at all these complex patients. Fibromyalgia is a chronic condition is characterized by widespread musculoskeletal pain and tenderness, more commonly found in women than men. And this could be, they could have a chronic widespread musculoskeletal pain that affects different parts of the body and often is focused on soft tissues and joints. They can have fatigue, having overwhelming tiredness that is not really by rest. They can have GI symptoms and like bloating, nausea, and irritable bowel syndrome. Mood problems, including depression and anxiety, which can be exacerbated by the chronic pain and fatigue associated with fibromyalgia. Cognitive difficulties, so it's often referred to as fibro fog and can affect with concentration, memory, cognitive processing. It's not fully understood why someone develops fibromyalgia. It is believed to involve amplified pain perception within the central nervous system, where the brain processes pain signals more intensely than usual. And taking a multimodal treatment approach might be including of pharmacotherapy, so patient using medication to manage their pain, fatigue, and other symptoms. With graduated exercise, you can slowly increase physical activity to improve strength and reduce pain. With cognitive behavioral therapy, with this approach can help individuals manage their psychological effects of living with chronic pain, such as depression and anxiety. And fibromyalgia patients often struggle with exercise intolerance, meaning they have difficulty with engaging physical activity due to pain or fatigue. So this makes them more prone to a sedentary lifestyle, and therefore they'll have more problems, more health problems. Myofascial pain syndrome, or MPS, is the next one, and it is a systemic condition. It involves painful areas of muscle known as myofascial trigger points, which that's what I feel like I have right now. Um, Also known as MTRPS. So these are localized hyperirritable muscle areas that can cause pain both locally or can refer to other areas. And the pain is caused by, thought to be caused by sustained muscle contraction that depletes oxygen and energy in the muscle and leads to a buildup of waste products and pain. They can have pain during muscle stretching or compression. The trigger points become painful when stretched or pressed upon. They can have referred pain because the pain from trigger points can radiate to other areas of the body, causing confusion about the source of pain. They can have difficulty sleeping, and because the muscle pressure makes it difficult to find a comfortable position. Chronicity is common as the sustained muscle tension and adequate blood supply to the affected muscles can cause a vicious cycle of pain and tension. And individuals with MPS may limit their physical activity as an attempt to reduce pain, but this can also make the patient experience more muscle stiffness and discomfort. And then the last one, osteoporosis, which we have a whole chapter that talks about, well, more so about OA, but osteoporosis is a bone disease that occurs when there's an imbalance between bone reabsorption, which is bone breakdown, and bone formation, which leads to weakened bones. So as a result, bones become fragile and are more susceptible to fractures. The imbalance occurs when the rate of bone breakdown exceeds the rate of bone formation, and that can result in decreased bone density. This leads to fragile bones that can break easily. It can be change in bone structure. So osteoporosis leads to alterations in the size and architecture of bones, making them more prone to fracture, especially in weight-bearing areas like the hips, spine, and wrists. Some risk factors for osteoporosis include age. So the risk increases with age. Women are more likely to develop osteoporosis because of menopause or after menopause due to the decrease in estrogen levels. With a decreased estrogen in women and testosterone in men can contribute to bone density loss. Lifestyle factors such as a sedentary lifestyle, poor nutrition, and smoking and excessive alcohol consumption. The condition can also be diagnosed using a bone mineral density test or B&D test and can help distinguish between osteopenia, which is weaker bones that are not yet fragile enough to break easily, osteoporosis, severely weakened bones prone to fractures. So treatment often includes weight-bearing exercises such as walking to help stimulate bone formation, taking calcium and vitamin D to support bone health, using medications to slow bone reabsorption and promote more bone formation. So these conditions, interact with each other, creating complex challenges for individuals with multiple diseases. And, when approaching treatment for patients, for exercise and rehabilitation, it's very important that you tailor it to the needs of the patient and considering how these overlapping symptoms and the contraindications. And that concludes our session today. Thank you all. You have a wonderful day.